The middle of the night and you're staring at the ceiling, thinking about work or bills or the kids. When the sleep just won't come, it's tempting to turn to a sleeping pill for relief, and you may get it in the moment, but if you regularly have trouble sleeping, that's a red flag that something's wrong. It could be something as simple as too much caffeine or viewing TV, your phone, or other screens late at night. Or it may be a symptom of an underlying medical or psychological problem. But whatever it is, it won't be cured with sleeping pills. At best, sleeping pills are a temporary band-aid. At worst, they are an addictive crutch that can make insomnia worse in the long run. That doesn't mean that you should never use medication, but it's important to weigh the benefits against the risks. A few years ago, if you went to your doctor about a sleeping problem, the chances would be very high that they would give you a sleeping pill. They used to be dispensed as if they were candy. Many people think that sleeping pills are the only reliable cure for insomnia. Almost 1 in 10 have asked their doctor for sleeping pills. People have been conditioned to think that they need these sleeping pills to sleep. What many people don't know about is the dark reality of sleeping pills. Doing sleeping pills is like making a deal with the devil. Short-term gain for long-term pain. Now let's see some of the problems with sleeping pills. The first problem is that they have a range of unwanted side effects. That include, they may make you feel sleepy during the day. It is known as the hangover effect. Sleeping pills often stay in your system long after you have woken up. It may cause you to become physically addicted to them. As a result, you suffer from a range of withdrawal effects if you stop taking them, including even worse insomnia than before you started taking them. Next effect is that they cause psychological dependency by encouraging the belief that you're somehow broken and that you need this sleeping pill just to be able to sleep at all. Also, they may cause a range of long-term health problems, increased risk of cancer, dementia, and death from all causes. Next problem is that they stop working. As your body gets used to the sleeping pill, it begins to stop working, sometimes in just a few weeks. In order for it to start working again, your dosage needs to be increased. This causes the unwanted side effects that we seen above to become even worse. It's an endless cycle. That is, your body gets used to the drug, it requires more of it, increased dosage increases dependency, then experience worse side effects and repeat all over again. Each time, the patient becomes more and more helpless as the drugs don't work for them anymore. The next problem is that these sleeping pills are not designed to cure long-term insomnia. Medical guidelines clearly state that sleeping pills should only be used for short-term or occasional use. They should be used as a last resort to deal with a short-term insomnia problem. Despite this, doctors routinely give out sleeping pill prescription to patients. They don't provide the cure for insomnia. These sleeping pills don't provide the cure for insomnia. They are only useful when the cause of the insomnia will go away after a short period of time. If the cause of insomnia isn't soon going to go away, then sleeping pills are not the answer. Now let's see some of the prescription sleep medications. There are several different types of prescription sleeping pills classified as sedative and hypnotics. In general, these medications act by working on the receptors in the brain to slow down the nervous system. First type is benzodiazepine, sedative hypnotic sleeping pill. They are the oldest class of sleep medications, still commonly in use. Benzodiazepines have a higher risk of dependence than other insomnia sedative hypnotics and are classified as controlled substances. They are primarily used to treat anxiety disorders. Benzodiazepines that have been approved to treat insomnia include esdazolam, flurazepam, temazepam, and triazolam. The drawbacks to benzodiazepine sleeping pills are that you can become both physically and psychologically dependent, like the withdrawal symptoms. The sleeping pills can lose their effectiveness if used on a nightly basis because the brain receptors become less sensitive to their effects. You may experience the hangover effect as been already discussed. Insomnia returns once you stop. Now the next class of sedative hypnotic sleeping pills is non-benzodiazepines. So these medications don't have the same chemical structure as a benzodiazepine but act on the same area in the brain. They are thought to have fewer side effects and lesser risk of dependency but are still considered controlled substances, and they include zaleplone, zolpidem, esopiclone. Next one is melatonin receptor agonist hypnotic sleeping pills. Ramelteon is the newest type of sleep medication and works by mimicking the sleep regulation hormone melatonin. It has little risk of physical dependency but still has side effects. Ramelteon's most common side effect is dizziness. It may also worsen symptoms of depression. Antidepressants used as sleeping pills. The FDA has not approved antidepressants for the treatment of insomnia, nor has their use been proven effective in treating sleeplessness. However, some antidepressants are prescribed off-label due to their sedating effects. And doctors usually prescribe this if they think depression could be a cause of insomnia. Over-the-counter sleeping pills includes brands such as Nitol. The main ingredient in this is antihistamine, which has the side effect of making you fall asleep. These types of sleeping pills generate millions every year for the drug companies. They are popular with consumers who see them as a quick fix that they can conveniently pick up at their leisure from the local pharmacist. However, whilst the antihistamine, as you know, does make you feel a little drowsy, it's not very effective at actually sending you to sleep. There's very little evidence that they work any better than a sugar pill. There are some other natural sleeping pills. They are also known as herbal sleeping pills. There are a number of different herbs that promote sleep. You can buy pills that contain just one single herb or contain a mix of different herbs. The big advantage of herbal sleep aids is that because they are 100% natural, they avoid the unwanted side effects. Herbs such as lavender and jasmine have been shown to increase sleep quality as opposed to traditional sleeping pills that reduce sleep quality. Chamomile. Many people drink chamomile tea for its gentle sedative properties. Kava has been shown to improve sleep in people with stress-related insomnia. Now let's see some of the tips for safer use of sleeping pills. First, never mix sleeping pills with alcohol or other sedative drugs. Alcohol not only disrupts sleep quality, but it increases the sedative effects of sleeping pills. The combination can be quite dangerous, even deadly. Number 2. Only take a sleeping pill when you will have enough time for at least 7 to 8 hours of sleep. Otherwise, you may feel very drowsy the next day. Number 3. Don't take a second dose in the middle of the night. It can be dangerous to double up on your dosage and with less time for the medication to clear your system, it may be difficult to get up the next morning and shake off grogginess. Number 3. Start with the lowest recommended dose. See how the medication affects you and the types of side effects you experience. Number 4. Avoid frequent use. To avoid dependency and minimize adverse effects, try to save sleeping pills for emergencies rather than nightly use. Next tip is never drive a car or operate machinery after taking a sleeping pill. For better sleep, opt for healthy habits, not pills. Research has shown that changing your lifestyle and sleep habits is the best way to combat insomnia. This will also act as a long-term remedy to sleep problems. If you still need to take sleeping pill, only do so as a last resort. Use the lowest dosage possible. Take for the shortest amount of time possible. Choose one that wears off quickly during the night. Only use them when required, such as one night in 3. Treat sleeping pills as a short-term solution. They are like a bandage. Bandages won't heal the wound, but they can be useful in the short term while the wound heals itself or receives the appropriate treatment. Also try to use natural sleep aids as much as you can. Thanks for watching.